Welcome back. Today we will be discussing different feeding options for new moms and their newborns. We will be interviewing Dr. Christie del Castilo-Hegyi, MD, and co-founder of the Fed is Best Foundation, which is dedicated to supporting and empowering parents to make safe feeding choices for their newborns. Thank you, Dr. Hegyi, for joining us today.
Thank you so much for having me.
Well, we've all heard the saying, breast is best. But through your experience and many of the moms that we worked with for the past 10 years, tell us a little bit about your story and why you co-founded Fed is Best.
Okay, all right. Well, the story of Fed is Best begins with my son's birth and breastfeeding experience. I was a first-time mom. I was an attending emergency physician. I had read all the books, all the breastfeeding books, parenting books, taken the classes, had everything lined up and read all the guidelines for exclusively breastfeeding my firstborn child. I wanted to do everything right. And when I had a healthy pregnancy, I had a healthy delivery. We were in the hospital and we had a lactation consultant and of course a pediatrician who saw us each day of our 2 days in the hospital. Everything appeared to be going well. His latch was quote unquote perfect. He was settled and feeding on the clock every 2 to 3 hours for 20-30 minutes, what looked to be satisfied, good feeding. He was losing the expected amount of weight and his numbers were fine. His bilirubin numbers were fine. And on the second day, before we were discharged, we were told he's going to be hungry. So just keep breastfeeding. And I knew very well as a new mom that, to avoid supplementation and because it could could ruin breastfeeding and potentially lead to other medical problems. So, we went home that day and sure enough, he started seeming more dissatisfied. He was feeding and crying. And then when he'd stop feeding, he'd go back and latch some more. And so I'd go in between. I knew all the techniques to try to massage and all of that stuff. And I did what I was told. And of course, that third day would have been fourth day of us being kind of sleep deprived. My husband and I were just baffled at how difficult it was. And we just pushed on because we're healthcare professionals and we're rule followers and we stick to it, what we're told, and we don't question what we're told. And we just did it, just persisted all through the night. And the next morning was our pediatrician follow-up appointment. And at that time, we weren't told, but we were told that he had lost 1 pound, 3 ounces. And I had no idea what that was because I was 4 days into sleep deprivation. I knew what 10% weight loss was, and that was the recommended maximum, but they didn't tell us what it was. And it turned out it was 15% of his birth weight that he had lost by the third day of life. And so we were told we had the option of either, feeding frequently, continue to feed frequently exclusively, or supplement with formula. I was sent home with a sample of formula, thank goodness. And, but, my husband and I came up with a plan. Okay, we're going to feed. If he fusses once, we're going to feed again. And if he doesn't, fuss anymore, then we'll leave it as it is and not give formula. But if he does, we'll feed formula. That never happened because probably he was tiring out. 4 days. So we went one more night doing the exact same thing. And the next day we just felt like there was something wrong. So we had made an appointment with a lactation consultant, kind of outside of the hospital lactation consultant. And there at that appointment, we discovered that he had gotten, essentially from a weighted feed, had gotten 0 cc's, like nothing, through breastfeeding. And when she had me pump, I was so sleep deprived that I didn't even know how to put this thing together. I was so sleep deprived, I was pumping and there was literally nothing coming out of me. Maybe like clear fluid of like 2 or 3 drops. And I remember that moment feeling so terrified, because the idea of a child going 4 days without milk, I knew that was a life-threatening, brain-threatening situation to be in. I'm an emergency physician. I take care of critically ill patients, and this is critical illness as far as, I mean, you know, as well as you can define it. And so already, you know, I was terrified, and I wanted to hear anything that would make me feel like this was okay. And so I asked, he got colostrum right? And of course I said, yeah, of course, of course. And so he got his first bottle, 2-ounce bottle, and he fell asleep. And actually, we took him home. We didn't feed him we weren't told to feed him right then and there. We took him home. We opened up that sample of formula and fed him. And then he fell asleep for the first time in like 48 hours. And then 3 hours into it, we set an alarm, set alarm. And when we woke him up, my husband got him from his crib, and he was unresponsive. And I didn't have to do anything. I mean, I looked at him, he showed me his little arm and did a little floppy thing. And then I went and just started making a bottle. I made that bottle so quickly. And then my poor husband, is the one who had to see this. You know, I didn't see it. You know, he was the one who saw it. And he took the bottle from me and just squeezed that bottle into him as much as he could. And then he didn't tell me this until months later, actually years later, but he didn't tell me this detail, but as he was feeding him, he seized and became more responsive. At that point, he was kind of like eyes open, not really that active, but eyes open and breathing. So we immediately took him to the emergency room. He got his labs drawn. And when I got his labs back, his sodium was 157. It'll be on the website. I can't remember all the numbers right now, but his sodium was 157. His bilirubin was like 24, 26, or in the 20s, mid 20s. And his glucose was 50. This was after a full bottle of formula. And when I saw those labs, when I know what hypernatremia does to the brain and bilirubin and all of those things, I knew I had disabled my child for the rest of his life. And I asked myself, why did this happen? I had read everything. I had attended all the classes. I had listened intently to all the discharge instructions. Why didn't anyone tell me that I could starve my child by following the exclusive breastfeeding guidelines to the point where he was almost dead and probably brain injured and disabled? Why? And so I thought this must have been the most freak accident that ever occurred, that this is probably a case study or whatever, because this is impossible, from at least the impression that I had from all that I had read. And when we'd gone upstairs to the ICU, and you know, I talked to the neonatologists and the NICU nurses. It's as if I was the 5th person who was coming into that hospital with the exact same story. I mean, I didn't even get finished saying my milk hadn't come in when she finished my sentence for me. And I said, I mean, it was completely baffling. Of course, everyone took care of him, gave him all the formula he needed. During that NICU stay, I was asked to pump, and again, was confirmed to not have anything. I mean, there were drops. I was like, how am I supposed to get these drops off the side of the flange? Right. And that's like where I was. I know this is kind of getting long, so you can cut off as much as you want, but I'm telling you the details because this is what it's like for a mom and a baby, for a family to experience this. And it was devastating.
I'm sure.
To realize that you had done everything that you were told to do as a new mom, what you were told was the best for your child, and to harm and torture your child for days to the point where they are in critical condition. is just about the most devastating thing to experience. And this is happening every week in every hospital across the world as a result of these standards. And no few parents, until our foundation existed, were ever told that it could happen. And so the foundation started when, 3 years later, my son was diagnosed with all the developmental disability, with all these developmental disabilities that I discovered were very closely linked to jaundice, dehydration, hypoglycemia. And I started reaching out to the authorities. I reached out to the CDC, the AAP, everyone I could reach about this condition, and I asked, why were parents not being informed? And I got very little response. So I went on my own. I wrote every pediatrician and OB-GYN in my state that had access to. I went on Facebook. I created a public page. I started paying for Facebook ads, and an avalanche of stories coming from moms, from health professionals saying, this happens every single day. This happened to my child. It happened just like this. I'd never spoken about it because I was so ashamed. And then I met with Jody Seagrave Daly. I found Jody Seagrave Daly, who's a NICU nurse and IBCLC, and we created this foundation, and we have a small army of volunteers and healthcare professionals who feel the same way. And we want to change. We want to change the discussion, the dialogue about infant feeding to reflect reality and reflect safety and prioritize safety for each mom, for each baby, and prioritize that. This shouldn't be happening. It's 2020.
Right. Your story is heartbreaking, and now of course, that you're not alone. Pam and I have owned a baby nurse agency for the last 10 years, and we've taken care of 1,000 moms, and they just don't have the support to help them. And so they count on their healthcare professionals. And so if they're being given bad or inaccurate or not updated information, we're going to see more and more of this. Some of the data I've read is that there's 10 to 12% of newborns being rehospitalized. And it's exactly what you're talking about.
Yes.
It's a tragedy. It's absolutely a tragedy.
Yeah, I mean, it's like the current readmission data doesn't capture the complications that happen during the birth hospitalization. In fact, the jaundice readmissions or extended admissions, like 75% are caught within the birth hospitalization. So it doesn't count as a readmission. So it's in fact a larger problem than what the numbers say. The complication rate is higher than the readmission rate. So yes, I believe the 10% number.
Yeah. Well, can you tell us, some symptoms of babies crying that, babies cry, that's how they communicate, right? So, new moms are basically told, the babies are going to cry. That's just the way it is, right? We're going to lose sleep or, whatever. What are some of the signals that we should be looking for that babies are actually hungry? They're not just looking for, to be soothed or, comforted. They're actually hungry.
Right. Well, I would say constant crying being the lowest hanging fruit. Constant crying that occurs even after feeding. Crying and reaching out, a lot of times babies will put their little hands in their mouths because they're hungry. That's what they need, input, something that goes in their mouth. They are hungry. When they're putting their hands in their mouth, they are crying nonstop. Classic signs of severe dehydration, jaundice, and hypoglycemia are high-pitched crying. I mean, if your child sounds like they're in pain, screaming, crying, that is a sign of serious hunger and, dangerous hunger and thirst. Not sleeping at all for hours, that is a danger sign. And then, of course, there's the in-between sign, like babies that are waking up every 1 hour, even every 2 hours gets a little questionable. Are they getting full? Are they really truly being satisfied? And then unfortunately, if they are forced to persist or go without enough fluid or calories for too long, then they start getting sleepy. And this will give health professionals and parents a false sense of, oh, my child's satisfied, when in fact they're getting worse. So a child who has not been adequately being fed and who's losing weight, and in combination with becoming sleepy, difficult to wake up, difficult to keep feeding. I mean, a child that's only feeding like 5 minutes and doesn't seem vigorous, falling off the breast after a very short time, or not waking up spontaneously after 3 or 4 hours to maybe 4 hours to feed a newborn. We're talking about newborn here. Those are concerning signs. It's a whole picture. It's really a whole picture. So it's like you can't hang in your hat on one thing. So people say, oh, well, a sleepy child, that's also the same sign as a satisfied child. Well, it's a whole picture. What's happened to your child before that? What were they transferring? Are they gaining weight? Are they continuing to lose weight? How fast are they losing weight? Now, all that information parents don't have, but they at least can understand screaming child who won't stop. That's not ever normal. That's not normal. So I think as just to cover the basics, that's what I would want to pass on to any new parent taking home a newborn who is being breastfed.
Perfect. Now, can we talk a little bit about the size of a baby's stomach? When we were in training, we were told, oh, don't worry, the stomach is so tiny, it's about the size of a cherry or a fingernail, a thumbnail. And now we're hearing there's different information out there that really makes a big difference, right?
Yes. We have been taught something that is flat out false. We haven't, and it is information that has been passed on to parents and health professionals globally to advance an agenda of exclusive breastfeeding, that breastfeeding has to be exclusive in order to be successful. And it is harmful. That actual data, if you look at the ultrasound measurements and autopsy measurements of a newborn stomach of a term baby, it is 20 to 30 cc's. The same amount that it is after the first day, the second day, the third day of life, the entire first month, it's probably 20, 30 cc's. That's what they're born with, unless they have some kind of anatomical problem like esophageal atresia, where they don't have the opportunity to, develop a normal stomach. A normal term newborn baby's stomach is 20, 30 cc's. So that is the reason why many newborns who are only receiving 5 cc's, whether it's colostrum or formula, look unsatisfied. Yeah. And this is where 5 to 7 cc's comes from data in the 1980s. The 1980s when we first, or probably preceding the study, of course, in the 1970s, and is when American breastfeeding advocates came up with the standard and goal of exclusivity from birth to 6 months. They studied the colostrum production, the amount of breast milk produced in the first days of life of exclusively breastfeeding moms and babies, dyads. So they expressed the amount and also kind of did some weighted feeds to measure the total amount produced in the first day of life. And they found the total production in the first day of life is about 60 cc's. So if you divide that by about 10 feeds in a day, that's 6 cc's. That's where that number comes from. Okay, because we want to tell parents that 6 cc's, which is the amount of mom produces in a day per feed in the first day of life, is enough. We need to tell them that the newborn stomach is that size, which it's not.
It's really important information. Now, Pam has a few questions for you as well, so we're going to bring her in. Pam, go ahead.
Can you explain the term triple feedings and what impact they can have on a new mom mental and physical health?
Yes, I can absolutely do that from not only from my experience counseling thousands of moms regarding this and experiencing it myself. It is a form of torture we inflict on new mothers in order to give them to again advance the idea to parents that breastfeeding must be exclusive in order to be successful. I can tell triple feeding is a process in which you try to increase your supply, your breast milk supply, by first breastfeeding to the full extent of your ability, usually 20 to 30 minutes, both breasts, and then going on to supplement the baby with formula to whatever they need, whatever they need to feel satisfied, and then going on to pump your breast in order to get the remaining milk that's in there. This process on its own probably takes a full hour. And then you do it again in 2 to 3 hours. So it means you're essentially doing a feeding for an hour, basically a third of the day, 8 hours a day, just feeding, and not to mention burping and the changing and everything else that you have to do. Some parents experience a feeding frequency of every 2 hours because their child may be not satisfied or not getting their, so they're doing it at 12 hours out of a 24-hour period. You can imagine what that's like for on your what the effect of that on your sleep. You essentially don't get sleep. I was told when I was a new mom with in the NICU by the lactation consultant in the NICU that I'm very concerned about your supply and that it might dwindle if we don't do something aggressive. I was asked to do this every 2 hours, and I did it. I did this for 2 weeks, and it's a wonder I did not develop postpartum depression. Part of that is I only had one kid. I had paid leave. I had a supportive husband, but I did this, and there are moms who do this for months. And I can tell you, I did this with my second. I did a kind of form of this with my second pregnancy for twins. If you can imagine what that's like, I did develop postpartum depression the second time around because you don't get sleep. You are pumping, you're watching the milk, the small amounts of milk coming into those bottles every 3 hours. You are failing in so many ways. You feel like you're failing in so many ways, and not being able to produce milk, and not being able to feed your babies, and not being able to bond with your babies. You can't even get the reward of being able to see your babies enough. I mean, some moms have to forego the feeding because they can't do it all. That's what I did. I had to forego the feeding because I wanted to get that. I wanted to pump it out and see what it was going on. And you don't even get to see your babies when you're a pumping mom doing something that, and so you're letting someone else feed your babies because that's all you're obsessed with. You're obsessed with the amount of milk coming out of those bottles, and it's harmful because it is causing harm to the parents. And I can tell you postpartum depression is harmful to the parents as well as the baby, because the babies need their moms. They need their moms to be happy and healthy. And I can't imagine a situation where, let's say, a mom doesn't have a whole lot of support and she's the only one to do this, and it takes 1 second of losing your cool to hurt a baby. I mean, I hate to bring it to this, but you know what I mean? Having heard enough stories, and seen, heard through direct interactions with parents, the experiences, the things that go on in moms who are depressed and struggling, you know what I mean? It's not something to take lightly. It's not moms being prima donnas or being selfish, that they are worried about their mental health while they're taking care of their newborns. So that's what triple feeding is. And honestly, The benefit of it, I am not certain. Honestly, I'm concerned because there's some moms out there who, even with all of the effort of triple feeding and doing, all the best practices that are told to them to triple feed, to breastfeed, to do all the supplements that are probably ineffective. Even with those, there are plenty of moms, what they estimate to be 15% of moms who will not be able to maintain lactation no matter what they do. And so that's not a rare mom. So there are moms who are going to find themselves in this situation where they're going to develop postpartum depression from doing this and gain nothing from it. So, I'm all for supporting moms for what they want, because there's also situations where you triple feed. Like I triple fed my first one and I was able to increase my supply from zero, like virtually zero, to a full supply in like 9 weeks. But it came at a cost, luckily, as far as like time away from my child and maybe, the risk of postpartum, but, it can go both ways, so it's when moms choose this, they need to be mindful of their mental state and have people around them to tell them, reflect themselves, what their situation is to them, whether things are going well or things aren't going well.
So, what are your thoughts about moms just pumping? Instead of breastfeeding, what are your thoughts about moms who just choose that it's more productive for them to breastfeed, whether they're going back to work or, for whatever reason? There's a lot of guilt to that, right? So, what are your thoughts about it?
Well, I support it. If a mom wants to do that and that's what works for her life and her baby and her situation, I totally support it. There are a lot of moms where that's the only way they can do it, that for whatever reason, pumping never worked out. Direct feeding never worked out. And I feel terrible that even for exclusive pumping moms, there are ideas floating around that that's not best or that's not legitimate breastfeeding when it is breastfeeding, you know what I mean? And why does it matter? And it really is very disheartening and really frustrating when the scientific community tries to push that same idea by saying there's some kind of magical benefit or difference between bottled breast milk fed babies versus exclusively direct fed babies, when and like the gut microbiome, and there are differences between gut microbiomes of every person. If you took it down, no one has the same gut microbiome, and they call it different, assuming with the unspoken belief that because it's exclusively breastfed or direct breastfed, it must be better, when they've shown no data supporting that the difference means better. So, and then it gets published in some kind of lay newspaper article as this, and that's the message that comes out to moms. And what is the harm of that? The harm of that is another mom is made to feel like a failure for not meeting the expectations of the WHO and every other organization that have blindly followed them. And it's harmful, and the mom community, we're vulnerable, because we're vulnerable. We believe in the messages. I'm a physician, and I have to deal with a lot of different people and a lot of different insults to, and other things in my daily life where I have to make sure that my self-esteem is intact. But I have never felt so attacked and so vulnerable as a human being than I did when I was a mom. That a message, any message that tells you as a mom and a parent, any parent, not even just a mom, like any parent being told that they're not a good parent or not the best type of parent, best parent you can be, it's devastating. And so all of this, there's so much mom shaming and so much competition that is so destructive to the parent community. And so, I think they're needing to work or needing to pump. I mean, needing to pump for work, but needing to pump in general, even if you don't work,
Right.
that's a valid choice.
Exactly.
Right.
Exactly.
Right. Luckily, we've been able to work with a lot of parents, a lot of moms over the years, and to be able to teach them that and help them through, whether it's the triple feeding or pumping and feeding. So we've been able to, try and help them get through that. But there's so many moms still that don't have that support, that, don't have a nurse there with them at night telling them it's okay. Whatever you choose, as long as you feed your baby, it's okay.
Yes.
And, that's what we have always preached. I don't care how you feed your baby, as long as you feed your baby.
Yes.
And how do you think people are responding to the concerns that new moms may be afraid to even try breastfeeding after reading some of the stories?
Well, I can tell you that many moms are afraid of breastfeeding after their child is hospitalized. That is the worst outcome you can have, because you not only scared a mom away from what she wants to do, which is to breastfeed, but you also put her child at risk. So honestly, people, and I've said this in conferences where I've lectured, I've said, the same kind of questions I've been asked by my colleague physicians, moms are going to be afraid to breastfeed. I've counseled thousands of parents, of moms mostly, on breastfeeding, even moms whose children have required hospital admission. And the vast majority want to breastfeed, even despite knowing the risks of what can happen. And even despite having a child who developed complications. Moms are much more intelligent than we give them credit for. We send every mom home with information on child seats, on shaken baby syndrome, on sudden infant death and suffocation caused by prone positioning during sleep, all sorts of really scary information for their child's safety. So this is just one more thing that parents should be aware of. And you know what? The vast majority, if not 100% of the moms I know that I've counseled, feel more empowered to breastfeed because they know that they have all the information they need to know to make sure their child is safe. Imagine going into a venture that could result in your child getting ill because you don't have all the information to make sure they're getting enough. You take a mom somewhere and they know nothing about any of this. And they all know, but we all know as mammals, that our children need to be fed in order to be safe. And so this is basic information. This is basic information. And the only threat this information poses is a threat to the idea that it has to be exclusive to be successful. I've said that a million times, this is not a threat to breastfeeding. This is a threat to the dogma that only exclusive breastfeeding is the way to ensure your child's health and future and a success in the future. And honestly, that is the main threat, to that idea. And I welcome it because it's not true.
Right.
We can have healthy babies being fed many different ways, and we are lucky to have options because once upon a time we had no options.
Right.
And babies died, and babies failed to thrive and did not do as well in life, health-wise and intellectually. They did not do as well in life. And now we have safe options, and we should celebrate that.
Yes.
We should celebrate that and not shame it.
Right. And I think just all the education that you've provided really, I feel like gives women a lot of power to be able to watch for those signs and know what to look for.
Yes.
Instead of just doing it blindly, when they don't have any support.
Exactly. And I know plenty of moms who have a history of low supply, who went through the whole triple feeding, the struggling to exclusively breastfeed, and ended up, because of that experience, only breastfeeding for 1 or 2 months and quitting because it was impossible, an impossible task to achieve. The same moms who tried it again, and Mom, I don't think she'll mind, I'll just ask her before that, but Steph Montgomery, who writes oodles and oodles of articles about breastfeeding for Romper, she, with her last child, followed a lot of the guidelines of Fed is Best, and is very educated about how to just make sure her child was safely fed. And she knew from the beginning that she was not going to get a full supply, so she supplemented from the beginning, and she breastfed for over 8 months, and it was pain-free, easy, sustainable. We have to focus on safe, sufficient, and sustainable. And that is success. Not only a child that was well fed, safely fed, but a mom who could do it and felt confident about her ability to do it and got the breastfeeding relationship that she'd always wanted. And all we had to do was change the marker, change the goalposts. And we're not doing that enough for new moms. We're not doing that at all, at this point,
And what kind of pressures do you feel that are on new moms now to breastfeed?
Well, right now, it is a hospital standard to pressure moms to breastfeed, and we are not giving moms all the information they need. They are being forced, effectively forced to only believe there's only one option. And it's harmful. You don't know what a mom can or can't do, and you don't know what her breast will be able to produce. And if you don't give her the heads up of what can happen and very common events that occur from that, then you're not serving her or her baby. So yes, there's a tremendous amount of pressure to just breastfeed right now, and it's the standard of care right now, and it's got to change. Not just the message, but everything. The entire educational system for new parents has to change to reflect reality.
Right. And I think you've really addressed this, but why do you think, if there's any other reasons in 2020 that we're really failing to safely breastfeed our newborns?
Well, maybe it's multifactorial. I think there's a lot more lactation failure / insufficiency than we estimated. I think maybe when we first, when we had the resurgence of breastfeeding advocacy in the 1970s and 80s, there was so much fervor and so much, activism around it that we created things, messages that weren't actually ever true. The idea that the vast majority, I don't know what their estimates of vast, they believe that 2% couldn't breastfeed, but 98% of moms had all the milk that's required for a child to thrive and not have feeding complications from birth to 6 months. When no data was ever produced, there's no data that was ever obtained to actually justify that assumption. So we grossly overestimated the power of breasts, and the ability of moms to breastfeed from birth to 6 months. And on top of that, not choosing to not fully study the event and the consequences of these. And then now we're also having moms who are delivering or having babies later in age, probably in the 1980s, average age was of first birth, having your first baby was in the 20s, early 20s, and now it's more like the 30s. So we have older moms, and we know lactation diminishes as we age. We have, because of the aging mother population, we're also having more moms deliver with comorbidities, so high blood pressure, diabetes, thyroid disorders, all sorts of things. So these are also risk factors for lactation insufficiency / failure. So it's multifactorial. And then of course, and then there are lots of moms who are now giving birth after fertility treatment. So now our technology has advanced, and now we're having moms who are older and who have fertility problems and maybe underlying hormone endocrine problems giving birth, who may not be able to produce milk either. So there's all sorts of reasons why the population is at risk of having of creating an epidemic of feeding complications. Now, on top of that is the institutional event of promoting exclusivity in breastfeeding. So the overwhelming message globally is exclusive breastfeeding is recommended from birth to 6 months. No mention of, oh, by the way, this is what can happen if if your breast can't produce that milk. No mention at all. I mean, almost uniformly, if you see any breast is best news article out there, there's literally no mention of what happens when there's not enough milk, or the options that you have to address that. And that, along with education to health professionals that stem from that, and then JACO or Joint Commission standards that actually incentivize exclusive breastfeeding rates, higher exclusive breastfeeding rates at discharge, you have, the perfect storm for an epidemic of feeding complications. I mean, health professionals are literally being disciplined, chastised, written up for offering formula to babies who look like they are starving and are dehydrated. And they literally have to have either lost 10% or developing brain-threatening complications like hyperbilirubinemia or jaundice, hypoglycemia or hypernatremia. They have to develop the complications of not being fed enough that make them critically ill in order to get a bottle.
Right. Yeah,
And
that is a huge problem.
That's unbelievable.
Yes. Being a healthcare professional, I ran into that problem quite a lot. What advice do you have for healthcare professionals that are educating new parents before they go home?
Okay. Well, number one, it's so funny because when I say these things, I feel like I'm it's like an act of treason almost, when I say that health professionals, I mean, it feels like an act of revolution to say some of the things that I'm saying, which is to give them the heads up. Sometimes breast milk and breastfeeding doesn't provide enough, and that it can cause dehydration and jaundice and low blood sugar that can be not safe for your child. And if you think your child is really hungry and not getting enough from breast milk, especially if it's in the middle of the night and you can't get a hold of anyone, it's not going to hurt your baby to give them some supplements. Okay. And it's not just formula I'm talking about. Some moms have stored breast milk. I really advise against casually donated breast milk. Please don't do that because it's not safe. If you are in the hospital and you have access to donor milk that's from the lab, that's tested, do that. There is literally nothing that can go wrong if you feed a child who's hungry. Literally nothing.
Yeah. So, lastly, what advice would you have for new parents? There's just so much information out there, and you're amazing. The information that you're providing in this interview is just top notch. But what is it, something for sure that you want to leave with new parents?
I do recommend, I do want parents to know, I mean, I know my story is scary, and now all of them that are listening to this interview have heard it, and all you need is to hear it once and you understand what you need to do for your baby. And I recommend that new parents to, go to Fed is Best, look at the resources. There's basic information, our parent resource website, on how to latch, how to know your baby is gaining or not losing too much. I mean, there's newborn weight loss tools. I recommend that the parents be aware of growth charts as their baby is growing their first year of life. I recommend that parents, if you want to breastfeed, that you learn how watch videos on how to latch. If you are going to be a supplementing or exclusively formula feeding mom or parent, I suggest that you learn how to do those things before you go in the hospital. I suggest that we have this very easy infographic called Hungry, and it shows you all the signs. It's pretty comprehensive. I put our brains to put this infographic together, but all the signs of a child who's not fed enough and when to call a health professional. I mean, that's one basic, one page of information that every parent should know. And then I have a feeding plan. I mean, we have birth plans, right? Why not a feeding plan? And on our website, there's a feeding plan that every parent can look at and decide they can discuss it with their OB-GYN or their pediatrician that they plan on having, once the baby's there. A lot of parents pick out their pediatrician before they deliver and talk it over with them. You have the right to choose. You have the right to choose how you want to address a hungry baby, whether it's breastfeeding, supplementing temporarily, combo feeding for the full duration, or exclusively formula feeding. All those things are your choice. And you're going to be given all the information you need, hopefully, through our website and on all those options, because every parent and baby is different, and there are hundreds of ways that best can be achieved. So arm yourself with as much information as possible, and know who you're going to talk to address those issues when they come up.
Yeah, that's amazing. That's great information.
Mm-hmm.
And there clearly is a gap in the information being given to our new moms and the
Mm-hmm.
support.
Yep.
So we so appreciate what you're doing. And we'd like to make sure that everybody knows that www.fedisbest.org is the go-to website. And hopefully we'll be able to put some of your information included into this course. That I did see your infographic of Hungry, and that's amazing. What a great job you did.
Thank you so much.
Thank you again.
Thank you for having me.
Love what you do, and we are your biggest supporters.
Oh, I'm so glad. Thank you so much for having me, and thank you for being
You're very welcome.
Thank you. Thank you so much.